Now, a mysterious surge in sudden heart attack deaths has gripped Karnataka's Hassan district. 26 lives lost in just 42 days. Alarming, most victims were young, some under 30, leaving families and doctors searching for answers. And as of now, there seems to be no clear pattern that has emerged so far, other than the fact that most of the deaths happened without any visible symptoms, with several collapsing at home or in public places. Let's take a look at a few cases now. Among those 26 who lost their lives was Sanjay. He was a 27-year-old newlywed from Sumanahalli Koppallu village. He collapsed after experiencing a severe chest pain at a party. Soon he was rushed to the Sumanahalli Primary Health Center by his friends, reportedly in a condition where he was unable to even walk. But despite immediate medical care, he died suddenly. Then you have Harshita, just a 22-year-old who passed away from a sudden heart attack in Komarahalli village. She was a young mother of two, an infant only 6 weeks old, and a 3-year-old toddler. Another one was Muthaiya, a 58-year-old English professor at the government first grade college in Holens Narsaripura. He collapsed suddenly while having tea during a break. Colleagues rushed him to the Taluk hospital, but he was declared dead on arrival. Another deceased, Ravi Kumar, aged 30, was reportedly healthy with no previous illnesses. He collapsed and died suddenly while visiting his wife's maternal home of Belur Taluk. Now, health experts point to irregular eating habits and sedentary lifestyle as possible causes. But with seemingly healthy individuals also being affected, there seems to be no clear pattern that has emerged so far, adding to the confusion. Karnataka Chief Minister Siddaramaiah has suggested a possible link between these heart attack and COVID-19 vaccinations. The Chief Minister has now directed a panel of medical experts to examine the possible clinical reasons for the sudden surge in deaths. A committee of experts has been formed under the leadership of Dr. Ravindranath, Director of Jayadeva Institute of Cardiovascular Sciences and Research, that will submit a report within 10 days. At the same time, ICMR and AIIMS have confirmed that there seems to be no direct link between COVID-19 vaccines and the sudden adult deaths. Investigations identified lifestyle and pre-existing health conditions as a key contributing factors behind such incidents, ruling out vaccine-related causes. And to discuss this further, I'm joined by our esteemed panel of guests this morning. I'm joined by Dr. Sanjeev Gera, who is the Director and the Head of Intervention Cardiology Fortis Healthcare. I'm also joined by Professor S.M. Prasad, the Chief Editor, IMA Focus Magazine Karnataka, and the Chairperson of Karnataka Adolescent Health Academy. Good morning to both of you, and thank you for taking your time and joining us over here. I would first go across to you, Dr. Sanjeev Gera. Dr. Gera, this 20 deaths in 40 days is an alarming number. This sort of a figure, a data, we have not really seen in the recent past. It is only happening in Hassan, strangely, and there seems to be no clear pattern that has emerged. Dr. Gera, at the very outset, what do you think is impacting these young lives that are leading to fatal heart attacks?
This is very true what we have been listening now. And let me tell you a fact that for last 1 or 2 years, especially after COVID, you can run it. Maybe it is just a coincidence, but we were already getting so many young heart attacks. And over last 1 or 2 years, around every third, fourth heart attack, they are basically below 40 years of age. So young heart attacks have been on the rise for the last 2 or 3 years. It's not that we are seeing between this pattern only recently, for 1 month or 2 months. But yes, the young heart attacks, we are getting a lot nowadays in our emergencies, and we have to be very clear whether it is a heart attack or whether it was a sudden cardiac arrest, because both the things are different. So heart attack can lead to cardiac arrest where one collapses suddenly while doing any heavy binge meals, taking binge meals, or doing heavy exercises in gymnasium, dancing on the stage. He can collapse. That is actually sudden cardiac arrest, which can be because of heart attack. But we need to prove whether it was a simple heart attack, a blockage of artery causing heart attack, or there were some other reasons also, like rhythm disorders or congenital holes in the heart, like since birth. So we need to be very sure. But yes, there has been a pattern. If it has been proved to be a heart attack linked sudden cardiac death, then there are many causes. And vaccine, we can't just blame vaccine for all these events, because there has been no evidence, no perfect solid evidence which links a vaccine to the heart attacks. But yes, mRNA vaccine, it was clearly demonstrated that mRNA vaccine can cause myocarditis, pericarditis, which is basically inflammation. It is not heart attack, but these can lead to cardiac arrest. So we need to be very sure whether it was a heart attack or a cardiac arrest.
से बाहर, जैसे मैंने कहा, कांग्रेस के
Well, that was Rajiv Chandrasekhar briefing on politics surrounding opposition and the BJP being at loggerheads pertaining to the emergency. But let us continue our very important conversation over the spike in sudden deaths that are being reported due to heart attacks in Hassan. I'm also joined by Professor S.M. Prasad, who's the chief editor of IMA Focus magazine Karnataka and chairperson of Karnataka Adolescent Health Academy. And a short while ago, I was in conversation with Dr. Gera, who mentioned a very important thing. I'll bring that question across to Professor S.M. Prasad. He says that, we have to differentiate whether it's a case of a cardiac arrest or a heart attack. But what do you make when AIIMS and the medical fraternity has practically ruled it out that there seems to be no real link between the COVID vaccines and these cases of heart attacks that are turning to be fatal?
Yeah, we are also shocked by the news which is happening over the last 1 week. And the way we are facing that, whether our youngsters need to follow different lifestyle and whether they are in the sedentary lifestyle, we need to know. And also, there may be a rare possibility of some self-medications which might be happening in some parts of the district. So we need to concentrate on that. And also one more thing which is happening, which can happen, these heart attacks, especially in winters, whether we need to be more alert, because the temperature comes down, especially in the early morning. So that one also we need to consider, apart from any arrhythmias and any other issues or lifestyle modifications and any other issues. But the problem here is it is happening in only one sector, or it is only in the one district. That is where we are all worried. So we need to take care as adolescents or younger generation. We need to more concentrate on the lifestyle or lifestyle of these people. We need to definitely we need to dig into the issues what is happening there. That is what I can say. But this is very alarming, happening at only one place or one district. So whether we need to consider any other districts also, we are getting reports. We need to know whether it has been underdiagnosed. Also, we need to know. We need to know more about this. But definitely, it is a very alarming sign where there is no cause and where we cannot explain as medical professionals. Definitely, as our cardiologists have said, that we need to do some of maybe the autopsies would give a better picture. Though we call it as a clinical autopsy when some medical related reasons are still we are unable to find out the cause. So it is better to investigate further. Anyway, our government has promised us, and also they have allocated this idea of the thing what to go about within the 10 days. I think we should be able to get the report. But this is very unnatural, the way what is happening, irrespective of the age, and that is the thing. And as far as we know, as the medical knowledge and the common medical man, we know that there is a surge in especially in 36 to 40 years of age, they are at higher risk, and the lifestyle modifications and any other drugs, whether somebody is taking their own self-medications, can also account for this. That is what I feel. But still, our hands are crossed to know more about this. We need to know more about this.
So a time-bound investigation has been ordered by the Karnataka Health Department that has constituted a panel that is headed by the director of Jayadev Institute of Cardiovascular Sciences. Dr. Gera, when this investigation is being carried out, when people are going to be looking at specific cases of these 20 such unfortunate deaths that has been reported in a span of 40 days, what are the areas of concern that we can expect them to be looking at? Is it a case of comorbidities? Could it be a case of underlying conditions? Because at the very outset, there seems to be a pattern where only young life, practically below 50, below 40 for that matter, are being impacted in this district of Hassan. Dr. Gera, I request you to please unmute yourself.
So basically, I think they should be asking their families about their lifestyle patterns and their dietary habits, any addictions, any sedentary lifestyle, too much intake of processed food, or very high smoking, binge alcohol, or any drug intake, like Dr. Prasad mentioned. So all this type of history, can give us a clue actually what happened. Like if someone was having earlier warning symptoms like any chest pain on walking, breathlessness on walking, or maybe he was, looking like fatigue too early after just a small work. Maybe that was a warning symptom and he was ignoring those symptoms. Any history of high cholesterol values in his lipid profile, high sugars, or maybe any unaccustomed exercise he undertook just before 1 or 2 days before this, sudden event. So I think they should be looking at all those patterns. COVID vaccine history can also be asked, but there is no solid evidence that links COVID vaccine to sudden cardiac arrest or heart attacks. So I think that should be the questionnaire which the committee should be looking at.
Dr. Gera, I request you to please detail it out for our viewers over here. This is of paramount importance. Is there any signs that people can possibly detect in their lifestyle, in the bodily function on a day-to-day basis that may trigger a cardiac arrest or a heart attack, for which they can take some precaution and perhaps go and get themselves checked up? Is there any signs that you can please tell our viewers about?
So basically, let me tell you one fact that only 5% of cardiac arrest or heart attacks, these are sudden. So there is before the fatal event. So those cardiac arrests, it is all cardiac arrests are basically because of rhythm disorders. So what happens? Your heart suddenly beats too fast, what we call ventricular tachycardia, ventricular fibrillation, and the patient suddenly collapses. So what you need is to do CPR or shock him so that rhythm can be converted to normal. And this arrhythmias or rhythm disorders can be because of sudden blockage in the artery, or some congenital or some disorders right from the birth, or maybe viral infection of muscle of the heart, or some drug intake or toxin intake like cocaine intake, which has been now very frequent, especially in southern India. And then heavy smoking, heavy alcohol intake, all these can trigger arrhythmias in already predisposed individuals. But 95% of cases, they almost have warning symptoms. And what are warning symptoms? The warning signals are heart always, cries. So whenever you are walking or whenever you are doing some heavy work or maybe any type of exercise which you have not done in the past, then heart needs more oxygen. And if there is a block into the heart itself, the heart will not get the enough amount of oxygen or blood. Then this is a symptom called angina. Chest pain on walking, breathlessness on walking, fatigue on walking, maybe leg pain on walking, and especially in women.
So there are certain warning signs that if left ignored can prove to be fatal for many people. I have paucity of time, but thank you Dr. Gera and also Professor S.M. Prasad for taking our time and sharing these very important insights on a subject that we'll be keeping a close track on. It's time to get across to a briefing that is coming across from Bengaluru.